Hey, this is Larry Spear. We've got another couple of minutes here before we get started, but I've opened up the chat. Could you, if you can hear me, would you just respond to let me know that you can hear me? Can you guys hear me on the call? Okay, great. Somebody said yep, so I assume we're good. Thanks for the response. We'll get started here in just a minute. We tried on Tuesday night to leave the line where everybody could kind of talk and ask questions, but we had way too much noise in it, so we're going to try to just let this thing, and I'll talk to you, and then you can see on the screen that's the way that you get a hold of me here for questions after the webinar is over with. So we'll give another couple of minutes. People are still coming in. Well, all righty. I'm a believer in honoring time commitments. So it's 12 o'clock according to my Mickey Mouse watch. So let's get started. I'm Larry Spear. I'm a National Sales Director for Lone Star Script Care. And this little contact information for you. You can email me at larry@lsrxcare.org. But also you can get a hold of me. I always, happy to talk to everybody individually. I'm really desire to help you get up and running with your business, and I hope you'll hear some of my passion for this product and this company as we go along. But I'm willing to help you do whatever I can to get your business up and running, which means we're helping a lot of people in the process, and that's really kind of the basis of life and kind of how I like to roll. So if I remember, I'll try to put this back up at the end so you make sure you have some ways to get a hold of me. So here's what we're going to do. My job here today is to introduce to you a brand new product that Lone Star has just released in the last little bit, and it's called the Select RX plan. This fits into the whole product mix. Many of you that are on the call may be using the free discount card program, and that's a good way to get your name out, help some people. So many of the others on the call will have been part of our flagship product now for some time, which is the Prescription Assistance Program, the PAP programs that for people who can qualify for it with the medication and their income and whatnot. It's just a great program, and just a little bit of an encouragement on that product. Millions of Americans could actually qualify for the program if they just knew about it. But we just added this one for people who can't qualify for a PAP plan, but still have struggles with paying for their medication. So I'm going to do a quick overview for you, and then again I'll be available over the next little bit to talk with you about it, help you get this up and running in your business. I do want to remind you, you'll be getting an email out over the weekend. We are going to do a training session on Tuesday night at 8 o'clock Eastern time. We're going to try to do one every Tuesday night, and in it, we'll talk about products and both the Select RX and the prescription card, and also the PAP plan. But we'll also talk about some marketing things. I think Tuesday night we're going to, because Medicare open enrollment's coming pretty quickly, I think we're going to spend some time talking about how to position this product to help a lot of seniors and at the same time grow your business. But anyway, so basically the Select RX program combines three real programs. It combines what we call a retail prescription card. This is a true PBM-based card. It's unlike the discount card that we give away, which is a good program. But some pharmacies, won't take it, or there's problems with it, or, just it's not always not 100%. The retail discount card that we have bundled into the Select RX plan is a true PBM. Those of you don't know what that means, it's a pharmacy benefit manager card. It's acceptable in all drugstores in America. It's acceptable even in hospital hospital pharmacies. And this allows us to, let's see, hold on a second. Somebody told me I didn't get my screen shared. Hang on a second. Oop. All right, now I think I got it. Sorry, I wasn't watching the chat either. So thank you for the folks in the. Sometimes technology will fool you. I've been so worried about the sound, I wasn't worried about the video. So basically, the products or the retail prescription RX card I was just talking about. This is a full-blown PBM-based card. It's unique to the card holder. Has their own member number and that sort of stuff. Basically, this works off of we call this on the commercial side of our world the copay crusher. As you probably know, 80% of the prescriptions in America are written today for generics, and of those generics, if somebody is paying $10 a month on a copay card, we can pretty much always save the money for about 70% of them. I tell this story every time. I take lisinopril. My wife works for a big education system here in the state of Georgia. She has Express Scripts through Blue Cross Blue Shield. My 90-day copay on lisinopril through her insurance is $15.60-something. The cash price at my local pharmacy is $10, but with this retail prescription program, it's $5.61. So in a very simple example, you can see the power in that. We can save a lot of people a lot of money just on their copays and paying cash instead of going through the copay side. The other real big program that we've added to this is a mail order prescription program that for brand name medications is just going to be tough to beat. And as a matter of fact, it'll provide you the lowest cash price of medication on name brands in the United States today, and that's a pretty big statement. But I'll show you some examples here in just a second to prove it. And then to that, we've added some additional discount programs. We have a dental program, vision, hearing, diabetic supplies. You can read it. Lab, MRI, and that's a very powerful discount on those imaging and lab services. So basically, that's the components of the product. We call it the Select RX. We can help people. The retail card is just tremendously beneficial for generics at the local level. The mail order program is unbeatable, in my opinion, on the name brand medications through the special mail order program. And then we've got all the other discount programs available that's in the package. So the overview, you guys know, pretty much got this figured out. I suspect there's no age limits, no health restrictions to the program. This is not insurance, so you don't have to be licensed to sell it while I'm thinking of it. There's no pre-existing conditions, no underwriting. You just, once you become a member, you get access to the lowest cash price of prescriptions in the United States. How about that for a big statement? It is good at all the stores, as we talked about, all the major stores. I use it at my local independent pharmacy. I believe in supporting them. And in fact, one of the things that we've discovered is that at the local store, you can find your particular pharmacy in the lookup field. you can go to that pharmacy, and many times you'll notice when you do the lookup that they're preferred pharmacies and then they're non-preferred pharmacies. Obviously, the preferred pharmacies, you're going to get a little better price. And but we've discovered that the local independents sometimes have a better price than the big chains using the card. So just kind of information for you. Here's some sample pricing, and I know that's small, but I'm doing this webinar with you right off of the information in your LS training, which I'll show you in just a minute, so you can go look it up. But I mean, you get an idea is that here's some name brand medications that you'll recognize. You'll see a comparison in in some of the local pricing in here, and then versus the mail order pricing. For example, you can look at Advair. Advair, locally for a quantity of 3 inhalers is, somewhere around $730 on our great discount card, but it's $58.66 through the mail order program. So again, somebody taking a lot of name brand, or somebody taking name brand medications and that are paying these huge prices, this is a great benefit for. How does it work? Well, basically, you first get enrolled into the Select RX plan, which is pretty much a membership program. Then they can call and get pricing. I'm going to show you here in just a minute. We've just added the pricing for you in your office. Then the member has the doctor fax in a prescription for a 90-day supply. We take it, we process it, we confirm pricing, payment, we send it to the pharmacy for fulfillment, and then it's shipped straight to the home of the consumer, and then refills are handled as we go along. So what's it cost? It's $29.95 for a membership fee. That covers the entire family. There is a one-time $20 processing fee, so the first month we'll collect $49.95. And then after that, it's $29.95 again for the whole family. The program is completely insurance agnostic. It doesn't care. It works with or without insurance. Works with or without Medicare and Medicaid. And basically, then the membership kits are mailed down in the hands of the customer in 7 to 10 days. Basically, you're going to apply for this right off of your standard replicated site. If you go to your site, you look down at the bottom, or toward the bottom, you'll see the new product in there, and you'll see a sample of it here. And basically, you're going to just fill out these screens just like you do for any of the other programs that you have used in the past. I'm not going to read them to you. I'm going to show you where you can find all this, but basically the questions and answers are here for you that people may ask you. Now here's what you guys probably want to know. Here's the agent information. Basically, we will give you a 6 to 9 month commission advance, which is unbelievable to me, but we're willing to do that. The $20 enrollment fee is not commissionable, but the monthly fee is commissioned each and every month that the customer stays active. And the commission rate on this product is 30%, and as it says, it is level every month. And then there is those of you that have a downline, there is a 5% override to your first level in the folks that you've recruited. Advances are paid every Friday. Nothing new. That's kind of how we do it on the other product that has an advance. Earned commissions are paid on the 15th of the month following last month. So commissions will be paid on August 15th. Again, no licensing required. You enroll on your site. All the training materials is available to you. There is a paper application, which I'll show you here in just a minute. And I guess that's really most of that. If you're not familiar with it, this is a website you need to know, and it's lstraining.net. We We have all the information here for you that for all the programs, the prescription assistance program, this program, Select RX, the free program. And so really all you have to do is you can come in here and all that material that I just showed you is available in here. The sample pricing is available in here. If you want to do check live local pharmacy pricing, you just click on that button. You punch in the username and password, and you pick your pharmacy in your area. You punch in the medication that tells you the price. That will be the price that you'll pay for it at the drugstore. These are live lookups, so there's no, there shouldn't be any discrepancy between what you see and what you pay. Let's see. To do the mail order pricing, if you want us to look it up and get back to you for it, you can punch on that button there, fill out the form, submit it, and then we'll get back to you. One of our advocates will get back to you with the pricing on the special mail order. But to make this easier for all the agents, the office just added the formulary in the mail order program. So you can actually click on that button here, scroll down, and you can kind of get past all the detail. There's your sample pricing of the most frequently prescribed drugs that are done here for you. And then you can actually scroll through here, and obviously it's alphabetic. And you can find the medication that you're looking for. You can look across to the right-hand side, and there's your pricing. Pretty simple. But again, if you're not comfortable with looking those things up, you can go to the mail order pricing and find them, and we'll do it for you. Let's see. So basically, just kind of how I would tell you this. Matter of fact, if you don't know that, there's the rest of the site available to you. Here's how I would, and I try to tell this with all the agents that I get a chance to talk to personally. And again, let me throw this thing up for you. If you'd like to have a conversation with me about the products, about how to sell it, about how to market it, there's the way you can get a hold of me, and I'll be glad to help you. Here's what I try to help agents, because I talk to a good number of you now. Is that basically the best way to position yourself in the eyes of a prospect or client already is to sort of be kind of like the triage nurse. If they will give you the information of what they're currently paying for their medications, and you can look it up and you can tell which way to go. Obviously, from many cases, if they're taking a brand name medication, with some of the costs that you see, you subscribe to that these days, and they can qualify for the program through the PAP program financially and through the other stipulations. The first line of defense for them would be a PAP plan, and that's $20 per month per prescription for an individual, and you can save people hundreds and hundreds of dollars every month in being able to help them get there. And then if the PAP plan doesn't work for them, if they're using some generics that may not be available, or they can't afford or they can't not afford, if they can't qualify for the PAP plan, then certainly you would then take them over to the Select RX program with the deep discounts at the pharmacy, local pharmacy, and then the super deep discounts on the mail order program. That's how we do it. Beginning a conversation with somebody about this as simple as are you paying more than $50, $75 a month out of pocket for your medication? Or you can do what we do a lot of times. Are you tired of paying for the high-priced medications that your doctors have put you on? And just begin a conversation with them. If you see that they are paying a good bit of money for medications, then just kind of you can fill out the form and send it to us, and we'll help you. I got a little form I'll send you if you'd like to have it. That's kind of a diagnostic tool. You fill out the form. You find out what their household income is, how many people are in the household. You get a list of the medications that they're taking. You get how much they're out of pocket every month for those medications. You send it in. We'll do the analysis work for you. We'll send it back to you, and then you can get a hold of the patient. We try to make it simple. After 2 or 3 times of us doing this and showing you how to do it, you won't need us to do the front-end work for you anymore. You'll be comfortable for yourself. So anyway, that's really all I wanted to tell you today. I try to keep these things within the guidelines of the time we've asked to spend with you. I am going to see if I can bring because I tried yesterday to open up the voice and it didn't work. So I've turned on the chat box. If you got a question, you can punch it in there for me, and I'll try to answer it for you. Somebody asked, what does PBM mean? That's just a short abbreviation for pharmacy benefit manager. All of the prescriptions that you take and get adjudicated at the drugstore go through some pharmacy benefit manager that's controlling those cards. The top three are Express Scripts and Medco and CVS these days, but there are dozens of others that are out there. Let's see. Yes, we can do group cases. If you'll contact me, I'll tell you how we do those. We have a pretty good operation going on the group side of things, and I'd be happy to show you how to do it. If they have a high deductible, would the benefit kick in right away? Absolutely. That's a lot of. I talked to a lot of under 65 health agents, and a lot of those are moving their clients to HSAs, which means they have a high deductible before anything kicks in. And absolutely, the benefit on the SelectRx plan are available time they sign up, and we get the membership fulfillment to them. Absolutely. Billing and enrollment. The enrollment is done through your replicated site. You when you go to that site, you'll just you'll go down to the SelectRx product. You'll hit the Enroll Now button and just follow the program. And then it's billed. We automatically bill it through if it's an individual sale, the enrollment system. They sign up with either an ACE or with a checking account, so that we bill them through an ACH transaction every month or credit card. So it just automatically handles that. Somebody's asking, please summarize which plan is best in which situation. We're going to go really deep into that on Tuesday night in the training, which you'll all get invitations for. But basically what happens is that if you're talking to a prospect or a client and they're paying a lot of money for medication, if their medication is name brand and they're paying a lot of money for it out of their pocket, which is almost always the case, and if they qualify financially, which means that the rule of thumb is $30,000 for an individual income a year, annual income, or $60,000 for a family income, chances are pretty good, matter of fact, they're very good in that scenario, that they'll qualify for a PAP plan, and you'd want to enroll them in our PAP service. If you're not familiar with how that works, basically they fill out a $25 enrollment fee. We send them a set of documents out. They have to prove their income. They sign a limited power of attorney for us to handle their prescriptions. After that, we contact the physicians. We put the application process together for them. We send it off to the pharmaceutical house. We mess around with all that bureaucracy for them. The drugs are shipped normally to their home, sometimes to their doctor's office, but almost always to their homes. and it's little or no cost to them other than the fee we charge them to do it. If they can't qualify for that PAP plan for either the medication reasons or insurance reasons or income reasons, then the Select RX plan would be the next step. Can a prospect call in direct to apply, and will someone be able to guide them to the best program? Well, yes, they can, but we always try to find out if they have a Lone Star agent, because it needs to we'll help them. We'll do the determination for them. We'll do a little advocating for them, but we're going to send them back to their agent to enroll them, so you get credit for the sale and for the enrollment and then the commission. Anything else? Does this? No, it does not. Somebody asked, does this program satisfy the CMS Part D for credible coverage? No, it does not. They're still going to have to have a Part D card. But I will tell you, the seniors are a great marketplace for us, because many of them are suffering with huge out-of-pockets every month, even with a Part D card, because the Medicare Advantage people have had to keep the premiums down. They're having to increase they're moving generics up tiers, and they're taking a lot of the high-end medication off of the formulary. All right, that it? Yeah, if in fact technology works, we will give you. I'm sorry. Let's see. Ready that again. Yep. Somebody asked, can we get a copy of the recorded? Yes, we can if the technology works. But we're also doing we will be recording this program for you in another way. So there will be a video that we'll embed in our site, so that you can get this information for your downlines. And yes, somebody at Lone Star can help you walk through a prospect enrollment, but it's or you can contact me, and I'll be glad to help you, because I'm probably a little easier to get a hold of. But it's really not complicated. If I can get it back right quick, I'll show it to you. Basically, you're going to go. These are screen snaps, but basically what happens, you're just going to take them to your replicated site. Let me get it down here. You're going to take them to your replicated site, and there's the picture. There's your home page. You're going to go down to where it says Lone Star Script Care, enroll now. There's the pricing. You can see it's a $29.95 every month, and then a $20 enrollment fee. And basically, you hit checkout. You fill out the information over here, and then if it's credit card, and then if it's a bank card or a bank check, you do it over here, and you hit submit order, and you're done. So it's not very complicated. But I'll be glad to help you on that one-on-one. All right, it's 12:27 according to my Mickey Mouse watch, so I'm going to end it. I appreciate your time today. I just want to leave you with the idea that this is a great program to help a lot of people and grow your business. So if I can help you in some way, you know how to contact me. I'll put it up here again one more time. You can email me, or you can just go out to lmspear.youcanbook.me and set an appointment. So you guys have a great rest of the afternoon. Have a good weekend, and I look forward to working with you going forward. Thanks for your time. Bye-bye.